Welcome to the Life, Love, Everything podcast. I am your host, Tasman Bueta. We are doing another segment in our RSV awareness campaign series, and it's called Spread Awareness, Not RSV. Respiratory syncytial virus is a common cold like, highly contagious respiratory virus causing mild cold like symptoms in most people. While typically mild, it can cause severe lung infections like bronchiolitis or pneumonia, which can result in hospitalization. RSV affects most infants under the age of 2 years, with the most vulnerable being newborn infants and small and sick newborns. Today, we are joined by Dr. Yuvania Chetty. Dr. Yuvania Chetty is a general practitioner and the founder and a doctor at the Pietermaritzburg Injury on Duty Center. She graduated from Wits University in 2014 and spent nearly 7 years working in public health care before transitioning into private practice. With a strong focus on patient centered care, which I absolutely love, she brings both depth of clinical experience and a practical approach to everyday health concerns. Beyond her work, she is a busy mom of three and wife, juggling the beautiful chaos of family and life while continuing to show up for her patients every day. Dr. Yavonia, thank you so much for taking the time out to come and speak to us today.
Thank you guys so much for having me. I really appreciate it.
You are doing the things. Being a mom of three, I can relate so much while juggling it all. I think that is amazing. So I must give you your flowers and a pat on the back.
Thank you. Thank you. It is, I think you use the correct word. It is a juggling act. There are sometimes too many balls in the air at one time, but yeah, we try.
Right?
Yeah.
That is awesome. Well, I'm so excited for our talk today because not only are you a healthcare professional, but you're a mom too, who herself has had her children experience RSV. So I think you bring two very unique perspectives to the conversation. But before we jump into the topic itself, will you tell us a little bit about yourself, your motherhood journey, and then we can dive into the RSV journey?
Sure. Okay, so I am from Pietermaritzburg, born and bred in Pietermaritzburg. Like you mentioned, I graduated from Wits, so I went off to Joburg for 6 years to study there, and then back in KZN to Durban to do my internship. And then I fell pregnant with my firstborn, who's now almost 10 years old, when I was in my second year of internship. So naturally, I found my way back home to to where the support is. I had quite a difficult pregnancy with him, and he was also born slightly premature. He's a 35-week baby. So thank goodness I was in an environment where I had the support. So yeah, that's how I found my way back to Pietermaritzburg. And yeah, we have settled here since. I worked at a state hospital in Pietermaritzburg for 7 years. And my second born, my daughter, was born in 2020. So she was born in February, and 3 weeks later we went into lockdown. So then it was, the heart of everything. And then the following year, when she was, a year and a half later, when she was diagnosed with RSV at that stage, and it was actually during that period in my life where I made the decision to leave state hospital and transition into private care. It was just the demands of everything were a lot to be a mom of two little kids that were under 4 years old, under 5 years old. And then I think with her admission, the reality of everything just got to me. And then I made the decision to move into private. So I still, I do practice medicine as a general practitioner, but I have a bit more flexibility with my kids. And then I have a little baby also. He's actually going to be 9 months old, so not so little anymore.
Wow.
But yeah. So yeah, a little tiny, our little bookend. Yeah.
Oh man, I love it. I love it. Sure. So how did that look like with your daughter having RSV in the hospital? You've got another child at home. We've got COVID going on in between.
Yeah.
Like, were you even allowed to be with your daughter when she was in the hospital? Tell us how that journey looked.
So thankfully it wasn't during the 2020 period, it was 2021 towards the end where some
Okay.
of the restrictions were lifted. So I was allowed to be with her. But yeah, it's scary because I've got another little child at home. I live very close to both my sisters who all have kids around the same age. So my younger sister had a newborn baby. So, there,
Oh.
there was there's so many considerations to take into place when you have a child that is admitted with a contagious virus,
Mm.
going home to other kids that are also going to school and also interacting with other family members. It's a scary thing to experience. But yeah, I thankfully was allowed to be with her during her admission, and yeah, wasn't easy.
So, what were some of the signs and symptoms that you noticed in your daughter, and when were you like, we need to go to a hospital?
So, as people know with RSV, it can start off looking just like a common cold. So, the fevers were there and a little bit of lack of energy. And it's quite tough because you don't know. And I always say this to my husband, who is not in the medical field. I always say to him, I don't know if I'm overdoing it by overanalyzing
Mm.
things and thinking it could be the worst case, or if it's just a common cold, but so it started off as a common flu symptoms, but when alarm bells started going off was when, and she's a very active little body, when she had no energy to play. She wouldn't want to get off the couch, wouldn't want to eat anything, just that lethargy that was there. And then the biggest thing that I think, whether a mom or a parent has any clinical background or not, the biggest thing was the difficulty breathing. So
Mm.
when you witness the struggle to breathe, I think anyone, like I said, whether you have a clinical background or not, that is when you think, okay, we have to get moving. So that is what pushed me to obviously take contact my ped and then take it into the casualty. And yeah, I'm glad I did.
Right? I think it's so important for us to trust that mommy instinct, and you know, rather you be that mom that is too much and overbearing, or that's always running to the hospital,
No,
than to just take it lightly, and it turns out to be a little bit more serious than what you thought.
no,
So I
you're so
think that.
right. Yeah, I had a mom come in the other day that came in, she came in with her nebulizer and everything, and she said, I'm so sorry, I'm sorry, I don't know. And I said to her, stop apologizing. Don't ever
Mm.
apologize for listening to your intuition or for trying to be the voice for
Yes.
your baby. So this child ended up being absolutely fine. And I think it was a case of her being a bit more anxious about it being something worse. But I said to her, do not ever start of walking into a doctor's room by apologizing for fighting for your child, because
I love that. I love
nobody
that you
knows,
said that.
nobody knows your child better than you do.
Yes, I agree wholeheartedly. And I think that's just also reaffirming to have a medical practitioner tell you that as well. Because a lot of the times, when you're the parent on the other end, you're even afraid to say too much because you expect that
Totally.
the medical professional knows better than you. But it's also something that I say to my parents as well. Like, you are the expert on your child. Like, no matter how well versed the clinician is, you are the experts on
Yes,
your
and there's a line between clinical knowledge, and yes, the expert or the pediatrician or whatever may know better than you clinically, but in terms of who your child is, you know best.
Absolutely. I love that. So, do you find yourself, and in that particular situation, were you having a battle within yourself as mom versus the medical practitioner?
It's sometimes it's a blessing and a curse. I say to have the knowledge of both, because I think having the clinical knowledge made me act quickly. I remember chatting to my husband after it, and like I mentioned, he is not in the medical field. And I was talking about, so you get something called alar flaring, which is when you breathe and your nostrils start, expanding, and that's just your body's way of trying to get in more oxygen. and we're talking, and I said, no, it's that flaring that is worrying me. And he said to me, what if you weren't here and you didn't that's something that he probably wouldn't have picked up. So I said to him, it is a blessing, and it is, the clinical knowledge definitely helped me to pick up on these signs and to act on them, but it's also curse because you think worst case scenarios. I mean, especially having trained in Joburg and working at Barra and these huge hospitals that they
Yes, where
really
you
really
see like the worst of the worst.
it is so if I can use the word, traumatizing, to have those thoughts, not as a clinician but as a mom, to have those thoughts going through your head, like,
True.
I remember seeing this and this happened to this child, and it's not always the nicest thing. So it's, yeah, the best and the worst of both worlds.
Absolutely. So obviously, because you are a clinician, did you get the RSV vaccine for your daughter?
So at that stage, we were not offered it, but now, like for my baby, definitely, it is definitely something that I feel so strongly about, because my daughter was admitted. My elder son, that's going to be 10, he was also admitted, and oxygen requiring when he had RSV when he was 2. So I've lived through this twice, and if
Twice.
at
Oh my
that
gosh.
stage I was offered something, or given the option of using something that could prevent these sort of things, I would have 100% gone for it. So definitely for the baby, I am all for the vaccine, and I would encourage anybody that, whether you have a baby that is classified as high risk, so the premature babies or immunocompromised babies, um, RSV does not only affect those kids; it can affect any
Yes.
child. It doesn't stop. You don't stop getting infected when you turn 2 years old. You can still get it. You can be admitted for RSV, and you can still contract it at a later stage in life. So the vaccine and what it can do for you, I think, is invaluable.
I agree. I agree, especially long term. Obviously, with the premature population or the sick newborns, you can just imagine that their arteries are so small already, and then you get this virus that is just, causing so
Secreting
much
everything,
strain
yeah.
on. Yeah. Like I really feel, and this is why it's so important for us to raise awareness that like all children should get the vaccine, just like we do any other vaccines, um,
Absolutely.
to
I would
prevent
hope at
any.
some stage it would move towards our road to health card compulsory sort of, you know.
I'm so glad you brought that up because one of our other moms said, but I didn't know it's not in the road to health, which blows my mind because considering it is one of the things that, if not all, most children will get RSV. Obviously, the severity does depend on case by case,
Yes.
but by the age of 2, most children would have had it, some unbeknownst to us. And to think that it is not widely spread is crazy.
Absolutely. And that's why I think platforms like your own are so important, because it just comes down to awareness. And
Absolutely.
if there's not posters up at clinics or in pediatricians' rooms, it comes down to things like this, where moms are made aware of options, or parents, yeah.
True, true, true. So, what do you think parents should be aware of when it comes to RSV? Like, when do you? I know you mentioned the flaring of the nose. Can you give us maybe like a list of symptoms to look out for, and at what point should you be rushing your child either to the doctor or the emergency room?
So absolutely, like I mentioned, RSV does just present as it can present as a common cold. So you get the runny nose, the nasal congestion, mild fevers, cough, sneezing, reduced appetite, irritability, normal cold symptoms. When it becomes more severe is where you hear, or where there's increased effort to breathe. So the clinical term is respiratory distress, but just for moms to be aware of, it's just an increased effort to breathe. So the wheezing, faster breathing, the nose flaring, chest recession is where, when the baby is breathing, you can actually see between their ribs, the skin is actually pulling in. So that's using the muscles off their chest because they need so much power to get a breath in and out. And then, just lethargy, dehydration, you will know your child is not themselves. And like I said, not every common cold needs to be put into an ambulance or driven to a pediatrician's room or to an emergency room, but you will know when it stops being a common cold and when it starts becoming worrying. And rather err on the side of caution, rather take a child with a common cold and be told they're okay, they will manage with supportive care, or thank you for bringing them in, these are the next steps.
Awesome. Thank you so much for sharing that. So we are based on different parts of the country. I'm in Johannesburg, and you are in Pietermaritzburg. And obviously you're so lucky because your guys' weather is so amazing. But we are heading into winter season here in the Southern Hemisphere. What are you seeing on the ground currently in your parts of the country?
So at the moment, our respiratory viruses haven't picked up yet. So in the pediatric population, there's a lot of gastro and stuff that's still going on. But I'm noticing a trend of it picking up slowly, and I'm pretty sure towards June, when our temperatures really drop, then that's generally when we have our spikes in our respiratory viruses.
Which I have seen just with us because we've been experiencing terrible weather of late. It's already hit us. And so yeah, and again, from the pediatricians that I have been speaking to on the ground, the children that are being hospitalized are not the preemies. It is your new full-term newborn babies. And so I don't know, Doc, if you want to speak to the fact of what can parents do to prevent? Should we be putting our children in isolation? Are we washing and sanitizing our hands? What
No,
are
well,
some rules and regulations parents of newborns should have in place?
so the one thing to know about RSV is it is a contagious disease. When COVID was around, everybody was so strict and stringent about hand washing, sanitizing, and then COVID disappeared and all these rules and regulations dropped. But it's a
Yes.
contagious respiratory virus. The consequences of a severe infection can be devastating. So parents with kids, not just newborn babies, parents with kids just need to be a bit more aware and a bit more conscious about these things. So it can spread through coughing and through the respiratory droplets from coughing and sneezing, from touching contaminated surfaces, saliva. My biggest pet peeve is kissing babies, which I cannot understand how in today's day and age it's still happening.
Right?
Don't feel bad for saying to somebody, please don't kiss my baby. Just don't. They are going to go home and be completely fine, and you will be the one in hospital 2 weeks later with your child on oxygen. So don't just like I said, it's shocking that it still happens. So definitely just for parents to be aware of still following these certain precautions. If you have a child that is sick, do not send them to school. Just as much as you wouldn't like your child coming home with something that they've contracted from somebody else, nor would another parent like that. If your child is displaying fevers, is coughing, is snotty, keep them at home. They really, I mean, missing out on 2 academic days when you are 4 years old is really not going to impact you in the greater scheme of things. I do understand that it is tough for some parents that are working and don't have alternate arrangements, but things can be done. Things can be done. And we just need to, especially as we head towards a season where it is spiking, just be aware of that. Be aware of your own kids not contracting from other people. And if you do have a sick kid, be aware of them not spreading it out.
I love that. I love that. I think that is some sensible, some sensible information because, like you say, I still don't. And I mean, my eldest son is about to be 16. But if he
Okay.
is unwell, you're gonna stay home because your body needs that time to rest. And what is the purpose in infecting 10, 20 other kids? And again, our systems don't react the same way. So you never know, maybe someone's got an underlying condition, and then now you've gone and made them sick, and theirs isn't just a cold, it's something so much more.
Yeah,
So
absolutely.
thank you for sharing that. So how are your kids doing now? I mean, I know that they are older now, but from a health point of view, from a preemie point of view, how are they doing?
They are thankfully thriving and well. But what actually I want to touch on quickly what you just mentioned with your son, your 16-year-old, and when you say stay home and rest, the one thing that people don't actually acknowledge about RSV is how exhausting the recovery can be. So yes, you may be sick
Mm.
for that initial period or for 2 or 3 days, but your body takes a while to recover. Rest is important. It is an exhausting journey, not just for the mom or the parent or the caregiver. It's exhausting for the patient as well, to whether you admit it or not, to have this virus take over your body and your breathing system. And yes, it may be out of your system, but it takes you're not back to normal immediately. So rest is so important. So now back to your question, my kids are well and thriving, but it did take them a while to just get everything out of them.
Recover.
My daughter, I
Mhm.
always say this is something nobody will ever know because we've never lived through this before, but she is a COVID baby. So I just feel that whether it's with regards to RSV or anything else, she does have a little bit of a weaker immune system as compared to my son. Because I mean, yes, we had no choice but to keep her home, and we were masking around her and sanitizing and stuff. But the body also needs exposure to certain viruses and bacteria to build up their own immunity. She was completely bubble wrapped and protected for almost the
Mm.
first 6 to 8 months of her life, which we had to do. We didn't know what devastating effects could happen if she contracted COVID, but who knows what long-term harm we did by not exposing our COVID babies to certain viruses and illnesses. So she does have a bit more of a weaker immune system. She is a bit more prone to, even if it's not a virus or just the common cold and stuff, she does is a bit more prone to these things. And I think parents have to be wary of your kids, whether they are a COVID baby, whether they are preemie, whatever makes them slightly more high risk or more prone to
Mm.
certain things. Just to be aware of that, keeping up with vitamins, sunlight, and just their exposure, to things, and helping them protect themselves, helping them to make sure that you're a bit more stringent about them sanitizing and things like that.
I
So
love that you mentioned that, and I actually didn't think about that about the COVID babies, because I also have a COVID baby, and I've never actually thought about it in that way, in that they didn't actually get exposed to any germs. Yeah,
So
and
now with
you
my
know,
with my 9 month old, I'm exposing him to everything. He really has.
and
I
how
mean,
is he? Like,
the
so do you
most
find that he's like healthier than the others because he gets
he
more exposure?
yeah, no, definitely. And being exposed to two kids, both my elder kids are at school and they are coming home with everything. So this baby is just living in a world where he has no choice but to survive. I think with our firstborns, we so maybe it comes with not being or being a first time parent. You're so strict and stringent, and we want to follow
Yes.
every guideline about protecting them. And not to say I'm any less protective of my baby, but he's also living in a world where he's got two older siblings that are going to school, and he has no choice but to survive in that environment. And I think sometimes our bodies realize that, and his body,
Yes,
I
and
mean,
they adapt.
I mean, he's 9 months old. My kids the elder two in the last 9 months have had colds and flu, so he's obviously picked up these things, and his own little body has now built up the immunity to try and fight these things off. So we'll see how it pays off in the long run. Like I said, he's only 9 months, so
Yeah.
uh,
Oh no, that is wonderful. Well, Doc, I think you have given us some very valuable information, and thank you so much for sharing your own personal experiences as well. I think it's so beautiful. Yeah, and
thank
yeah,
you. No, thank you so much.
thank you for taking the time, because I know you're a busy lady.
No, no, no. It's been a pleasure being here. Thank you for having me.
Awesome. And with that, everybody, you are listening to the Life, Love, Everything podcast with me, Tasman Buerta, and we just had our wonderful guest, Dr. Yuvania Chetty.